Hey there, my name is Sarah Ford. I'm part of Dr. Rodriguez's Pathophysiology course through University of New England Online, and we are doing week 2 discussion board on definition of various terms assigned to us. We'll start with disease, which is defined by World Health Organization, is not just the absence of disease, but the state of complete physical, mental, and social well-being. So we discussed this in our week 1 discussion board, that a patient who comes in because they have suicidal tendencies or a strong history of depression or bipolar disorder is just as at risk as someone coming in with signs of a stroke, depending on what they might do with that. So we need to apply our skills clinically, not just to sway for the absence of disease, but also to treat toward a degree of well-being for that patient, both mentally and physically. The next is etiology. Etiology is defined as the cause of disease. For example, here, cancer would be caused by the uncontrolled growth of cells. Disease classification indicates time of onset. So you could have congenital disease, where you are born with something, or acquired disease. So it happens before death, but after birth. An example in differentiating it and showing the value of these things would be deafness. A patient who has acquired deafness at some point in their adulthood will be treated a lot differently than someone born with deafness, due to something with their eustachian tubes. So the next one is pathogenesis, and that's the overall development of pathology or disease process, or what is supposed to be expected from that, the evolution of that disease. So in my line of work, cirrhosis is something that I encounter pretty commonly. Cirrhosis of the liver will create very dense parenchyma in the liver, and blood vessels won't be able to compensate for that. So the blood flow into and out of the liver will not always be so effective. So that might cause portal hypertension. Symptoms and signs and syndrome I kind of did collectively. Symptoms are subjective or unobservable by someone outside of that patient. So generally the patient will point this out, like a headache. A sign from the patient complaining of a headache might be something observable, like elevated blood pressure. A syndrome would be a collection of both signs and symptoms. Personally, I have an example. I have Ehlers-Danlos syndrome. So I have a symptom of inflammation and swelling in the joints. Something that could be a sign and a symptom is weakness. If a patient does, if a physician does a physical exam, they'll see that I'm weaker than most people. So there we go on that. It's kind of a combination of signs and symptoms, a syndrome is. Complications are outcomes that are adverse or unwanted that happen alongside disease process or the treatment of the disease. For example, hyperemesis or adjacent healthy tissue is being damaged during procedure, or radiation for cancer. So a patient comes in hoping to get the cancerous cells depleted, but healthy tissue might be damaged as well. Prognosis is the projected clinical course for disease based on experience and research of that physician and the physician group. So commonly in cancers, we're giving a prognosis on percentage or likelihood of survivability and a time span. So 1 to 5 years or 5 to 10 years, how many patient population will survive in that time period. That is all the definitions I have for you today. Thank you very much and have a good one.